So what would you say? Because that has obviously been quite a challenge to go into those environments and convince people that you are capable, you have the skills, you can do this, you can be in surgery, you can communicate to the surgical teams. What would you say to people who are feeling a little bit different, or maybe feel like they're being held back in some way? Like, what kept you going forward when you had people giving you that feedback that, oh, I don't know, if you're going to be able to do this? Like, what kept you moving forward? What was that conviction?
Networking, I think. So when your network is smaller, if you have hearing loss, you overhear fewer things. And one way to get around that is go up to people and take an interest in their careers, learn how they did X, Y, and Z. And I will frequently tell people I have hearing loss. I've had to do X, Y, and Z to overcome that. And I would really appreciate if you could help give me some feedback on how I could interview better, how I want to do what you do. I think that yes, I definitely enjoy people at baseline, and I really enjoy getting to know new people. So I think that's helped me quite a lot. And there was a deaf guy who signed, and he helped invent the TDD, the telecommunications device for the deaf, so that people could talk online on the phone before chat rooms and relay services became available. And he told his grandson, who is also deaf, he said, whatever you do, make as many friends as you can, go and talk to as many people as you can, because in the end, hearing loss is what's taking you away from people, and you need to learn to establish that contact. And that's what I would say with people: network, network, network.
Okay, awesome. Thank you. So another question is, as you well know, so cochlear implant technology has been approved by the FDA for over 40 years, and yet less than 5% of people who are candidates or who could benefit from it globally have it. What do you think why do you think that is? What do you think is holding people back?
Well, I think that hearing healthcare in America is atrocious. Audiologists are paid only for diagnosis and provide diagnosis of hearing loss and providing hearing aids to patients. So they're not encouraged, and I'm not saying on a personal level, I'm saying on a monetary reimbursement level, to for auditory rehabilitation, oral rehab, teaching people how to communicate better with hearing loss. People have to go to a speech therapist for that. And I don't think speech therapy is the people who are experienced all the time with that. So the reason why I'm mentioning that is the system is biased to providing hearing aids. And I've seen many patients come in with hearing aids that are either poorly fit and they don't adhere to best standards. Only about 2 out of 10 audiologists adhere to best standards, like using real ear measures when fitting hearing aids. And those are crucial for people with severe to profound hearing loss. So the system is biased to providing hearing aids and not for auditory rehabilitation. So there is less of awareness among audiologists and hearing aid dispensers, because hearing aid dispensers do a lot of providing hearing aids and treating hearing loss. So patients are just get another hearing aid, and there's no education at that level. The public thinks that cochlear implants and surgery is super complex. I mean, relative to a lot of treatments, I think that selecting patients for cochlear implants and guiding them through that process is actually pretty complex. I think the actual surgery itself is one of the simpler things that we do. Once you have the hang of the surgery, it's not really that big of a deal. It's not a super involved surgery. Even the hearing preservation component of it is not super involved. So I think there's a mistake in the part of audiologists and the public, is that it's this complex, invasive surgery, which it is invasive, but it's a safe surgery. The other thing is, I often hear people say implant didn't work, so they're not going to get it. And that can see from either audiologists who don't understand patient selection and the factors that go into making an implant work. And then patients who don't understand that every hearing loss is different, and that, yeah, I mean, sometimes they don't work in terms of benefiting a person's hearing more than hearing aids, but that is the minority of cases. I think there's mostly an awareness problem, which is why you've seen some of the manufacturers go off and do pharmaceutical style marketing.
Okay, awesome. I agree. I think there's such an awareness issue as well. And I mean, I can remember, I mean, got my first implant in 1997, so it's been a beat. But at that time, I had tried up till then for the 15 years prior. I never was a successful hearing aid wearer because my hearing loss, it was the ski slope hearing loss. So any of the speech aid that I needed, it could not provide. It simply could not provide. It couldn't help that level. But I remember, and I totally understand, because of course the medical professionals, I have to give an informed consent and help you understand. But I can remember just being shell shocked, and like when I'd been approved, they're like, yes, you're a great candidate. And I was still skittish because I'm like, okay, I've had 15 years of, I can't even tell you how many audiologists saying, oh, this, you know, every year I would go and have my hearing tested, and they would say, oh, this next hearing aid, this new technology, this for sure is going to work. 15 years of that, and it never worked. So I was so skittish to even go for cochlear implant, you know, to see if I was a candidate, to see what everything. I was just like, this is never going to work. But it came to the point where I had no other options because my hearing was so bad. I just graduated from college. I'm like, I'm not even going to be able to work in the profession that I've just spent 4 years doing. But I can remember them saying like, well, we can't say for certain it's going to work. All voices might sound the same. Might sound computerized like Mickey Mouse. There's a chance of facial paralysis because, you know, where we're doing the surgery is so close to the facial nerve. I mean, it was just like what on and on and on and on. And I just remember sitting there thinking, going, I finally like crossed the threshold of like, I'm ready for this. And then to have that come back at me. And again, I understand it, but holy cow, I just went home going, why in the world, if I've just been told for 15 years that, you know, this, you know, hearing aid technology would work, now I'm being told that I'm a great, excellent candidate for this, but now I have to have my head cut open and all this stuff. It was really, that was a really, I was so disarmed by that. So
it's terrifying.
As the unique position that you have as a cochlear implant recipient, as a surgeon who does cochlear implant surgeries, just in a little snippet, take us through what that is like, what that process is like, what the surgery, the time, the recovery, what that is like in your opinion.
So it depends. It depends if a patient finds us for cochlear implants or if I'm recommending them to them. So there is a soft point where I will recommend all patients get an implant evaluation, you know, but if you have pretty good hearing, but it's been getting worse and you're likely going to need a cochlear implant, I will probably recommend getting an implant evaluation sooner to introduce you to the concepts. So after patients get an implant evaluation, they come and see me and we talk about their medical history. Our main goal at that point is, if they're a candidate that the audiologist has identified, is to make sure that they can undergo surgery, which is almost all the time. if their cochlea will take an electrode, get a CT scan for that, make sure the cochlea is open. That predicts it about 80% of the time. Sometimes people have middle ear disease or meningitis or other things that can prevent you from getting the electrode in the cochlea, or you have to do other things to protect the implant. So for example, some people have collapsed eardrums and they need a little bit of an eardrum surgery to help protect the eardrum from being eroded by the electrode. So there's like a lot of little factors around the ability to insert the electrode that you have to identify. That said, the vast majority of patients are just fine. You know, they're not complex patients. They just lost their hearing at some point in life. Their cochlea is open. You just put the electrode in and go on. So get a CT scan or an MRI, depending on the patient. And then we schedule surgery. By that time, they have had their implant evaluation. They've chosen the components they want. They've talked with other implant patients. And the day of surgery, they come in, and this is usually a between 1 and 3 hour procedure for the patients. They go home the same day. They have like a little head wrap. Most patients are up and around the same day and back to normal within a couple of days. They come in, they let things heal for at least 2 weeks, and then come in and get their implant back activated. Then they'll come in usually about a total of 6 times over the course of a year to get the implant fine-tuned and up to speed. So.
Okay. Awesome.
Most of the benefits come in the first 3 to 6 months, and then once people get to about 6 months, their ability to hear in quiet, kind of like that's around where they're going to get, and then they'll get better and better at hearing in noise and hearing in music up to a year, and sometimes longer than that. Their ability to localize sound will improve. I've heard of reports of people improving as late as 5 years out. Yeah. It's a super stressful period for patients, as you just mentioned, you know, because they, despite being told to keep their expectations low and everything, they're like, you know, they want it to go, they want to be able to hear. Everyone wants to know if they can hear, you know. And just to put this in perspective, I had a very well-known implant surgeon who asked me one time after he got his implant, and he said, you know, I've done many cochlear implants, and I over the years, and I got my implant, and it sounds awful. It sounds absolutely awful. It's gonna get better, right? I mean, that's how viscerally disturbing it is to be able to have like this noise pumped in your ear and like be scared to death it's never going to get better. And for most people it does, you know. Some people are going to do very well, and they'll call the clinic, you know, leaving the clinic that afternoon, like they'll be on the phone like, this sounds awful, can you make it sound better? And like, you're talking on the phone.
You're talking
the same
on
day
the
as your
phone.
surgery. same day as your activation.
Right. I'm so glad you mentioned that, because I think that's one of also a massive misconception in the general public, if they happen to know about cochlear implants at all, but they think it's like, you know, putting on a pair of glasses. It's like, right, boom, you've had the surgery, so now you hear perfectly. And it's just not that way. And, you know, as you know, in the Joyful Life Cochlear Implant Fund, I'm doing confidence coaching for recipients. And, you know, and of course, having met numerous recipients over the last 25 years, that's definitely such a misconception that it's you know, kind of upsetting for the recipient, or just, you know, because they don't know. I mean, it's so much like you described. It's so much on all of them, even like the surgeon you just described, who's been around this for so long and is so disoriented. But it's really hard because you're trying to process it yourself. And then you have friends and family who, of course, I'm sure most of them have the best of intentions, but they're like, but yes, but now you can hear again. And it really makes that stressful as well. So what would you say to friends and family of newly implanted people about helping support, you know, someone in that adjustment period?
I tell them the story of what I just told you with my friend who's the implant surgeon, and I tell them usually they have a significant other, or family member, or friend there with them, and it's like, don't ask them how it's going, just let it go, and don't put the stress on the patient, because it is stressful when you ask. And I tell them, at the end of the appointments with me, I let them know, like, you can ask me questions about my experience. I'm not offended at all. Like, please ask, and I would tell them, like, when I had my implant on, I went to this implant support group meeting right afterwards, and all these people with their implant were coming up. You're doing so well. You're doing so well. And I'm like, I'm lip reading. I can't hear a damn thing. I'm just lip reading,
Oh,
So, but I mean, like, it's amazing. Like, I usually don't see my patients after activation. And I had this patient who had some other issues I was taking care of. And he comes back to me about 3 months after. And before, I could only talk to him with like auto captions, like underneath my chin, and he could talk. And like, he's understanding me with the mask, and
wow.
he preserved his residual hearing. It's just like amazing. So and he actually asked me about starting a new job during the activation period, and I said, no, you can't do that, because part of starting a new job is getting good first impressions from people, and it's very hard to overcome negative impressions. So you want to make sure that you get off to a running good start. So I'd encourage you, if you can, to like wait on starting a new job. And he did that, and things are going well for him. So yeah.
That's awesome. I mean, what an amazing gift for your patients to have someone that just has that compassion and the insider info, if you know what I mean, to be able to just to relate. And I'm sure they're very comforted by that, because they know that exactly what they're going through. So I think that's just so incredible. So I really, really, really appreciate all the time and the information. Is there any last thoughts or advice
Mm.
that you would like to share with us?
No, cochlear implants work. They work for 80% of actually, I tell my patients that if we recommend an implant for you, 8 times out of 10, your hearing is going to get better than your hearing aids. 2 times out of 10, it's going to stay about the same, but it's not going to get worse. And as your hearing would have otherwise declined, you're going to maintain that level. And then maybe 1 time out of 100, your hearing will actually get worse with an implant. So the odds are overwhelmingly on people's side. The chances of an infection or other serious complication is pretty rare. So we're not overselling these devices. They work. And when people think of it as an invasive surgery, I'm like, if you look at the risk profile of taking your appendix out, like postoperative infection rate, or it is somewhere between getting your gallbladder out and having your appendix out. It's safe. We do this all the time. And yeah, I mean, it has people's quality of life goes up with a cochlear implant.
Yes.
And it actually doesn't matter how well someone hears with a cochlear implant. It's if they are a super well-performing user, meaning they can lip read they can hear without lip reading nearly everything, versus someone who can't even talk on the phone.
Right.
These two people, they're going to like their implant.
Right.
So I think it's really important for people to keep in mind that cochlear implants work.
Yeah. Awesome. And you're exactly right. That quality of life component is such an incredible thing. So even if, like you said, even if it just aids lip reading at the bare minimum, that's still a step in the right direction and can help take stress off people, help, they're not so fatigued at the end of the day. So yeah, all in all, it's such a great thing. So I really, really appreciate having the opportunity to speak with you. So Dr. Ruffin, thank you so much for joining us. And awesome. I have a feeling we'll be talking again.
Thanks for having me. It was wonderful to be here. And thanks for all the great things you're doing for implant recipients. It's a good tool to have in their belt to know that they have an organization they can go to if they need help getting things.
Awesome. Thank you so much.